Good morning, nurse anesthesia students, and welcome to Nurse Anesthesia Practice, Advanced Principles 2, Trauma and Anesthesia. My name is Anthony Peverini. I'm a CRNA. I've been a CRNA for over 20 years, and I've been involved in combat anesthesia and trauma for 5 deployments, 3 in Iraq and 2 in Afghanistan. I'm currently a Doctorate of Nursing Practice student at Duke University. And it is my pleasure today to teach you trauma and anesthesia. The target audience, as you will see here, student demographics and contextual realities. The degree program that you are all seeking is a Doctorate of Nursing Practice in Anesthesia Nursing. You all come to us today with, at a minimum, a baccalaureate in science and nursing, and most of you several years in critical care. You have extensive experience already in managing fluid volume ventilator status. This will enhance those skills that you already have in your previous practice in a manner that relates to trauma patients and fluid volume deficits. This is clearly focused for advanced practice nursing and anesthesia. We're going to use several learning methodologies to include video, readings, and virtual lab. Some of the more traditional learning methodologies will be used in the lecture that will be presented in the next few weeks. So you all received a syllabus at the beginning of the semester, and this syllabus delineated the objectives overall that you're expected to know. We want you to first of all develop a plan of care for patients that are undergoing trauma surgery. You'll be asked to assess several pieces of information to include acid-base status, fluid management, electrolyte balance of an anesthetized patient during trauma surgery. You all have extensive experience as critical care nurses in how to manage a lot of these things. This will just give you the anesthetic implications for these particular type of patients. We want you to examine pharmacologic and non-pharmacologic interventions. Trauma presents itself in a multitude of ways, to include chest trauma, which may not necessarily need fluid volume resuscitation unless there's bleeding, crush injuries, all of these things that may affect the status of a patient that may not need pharmacological intervention, and those cases that do need pharmacological intervention and fluid volume resuscitation. We want you to apply the concepts of nurse anesthetic care to these particular type of patients depending on their traumatic injuries. So we're going to do this in a very specific manner. We're going to have you view video on preparing a care plan. This anesthesiologist will go over the things that you're trying to cover. You'll need to particularly view that you maintain the triad of anesthesia, analgesia, and atonia, making sure that you cover all of those things so that appropriate surgical care can be delivered. You're going to view a video on the specific things that are related to a trauma patient. When should you or when should you not deliver anesthesia? And believe it or not, there are times when the patients are so sick, their volume status is so bad that certain types of anesthesia may be inappropriate for these patients. So this anesthesiologist in this second video goes over the times when you should and should not choose anesthetics. And we're actually going to go over this in the lectures that follow these prerequisites. You're going to read a case report and review a practice guideline on volume resuscitation. And then ultimately you're going to go through a virtual simulation that will ask you in real-world scenarios how to deal with the hemodynamic changes that happen with a trauma patient, even prior to anesthesia, and then definitely while the surgeon is trying to do damage control. So let's look at the first activity that we're going to ask you to do. You'll basically log on to YouTube. You'll either search, or in later slides you'll see a link to fundamentals of anesthesia care plan. This anesthesiologist will go over in a 21-minute video the things that you need to cover for your care plan. Ultimately, we would like you to focus again on that triad of anesthesia, analgesia, and atonia. What you'll do is he'll go over the parameters for that. We would like you to bring that care plan to class. And that'll be one of your criteria for completing the prerequisites for this course. The second learning activity that we would like you to cover is to either search or use the access at the end of this lecture for anesthesia for major trauma and damage control. I realize that anesthesia is spelled in the British manner and not the American manner, but this is a British anesthesiologist that goes over certain modalities as to when and when you should not deliver anesthetic to a patient that has a traumatic injury. The video is approximately 18 minutes long, and we want you to be able to address the decision points when you should and should not deliver an anesthetic, and even when you deliver an anesthetic, what choices you should make for those anesthetics based on the patient's hemodynamic status. The next learning activity that we would like you to do is to access a case report on intraoperative cardiac arrest from fluid volume deficit. The unfortunate ultimate sequelae of a patient that has massive blood loss due to a trauma is cardiac arrest. The whole purpose of this lecture is to avoid that scenario, and it'll just go over some things that may have been missed intraoperatively in the case report. And the second thing is that blood volume resuscitation is a crucial learning point and technique that has to be addressed in trauma anesthesia. So next you'll evaluate the American Society of Anesthesiology's practice principles on intraoperative blood loss and decision points on when to give blood. Most of you probably know that from your critical care background, but this will just be a refresher on skills that you may have already learned. The final learning activity is you'll log on to the website that you see there. You'll tab over to SimStat Trauma, and you'll begin approximately 40 minutes to an hour based on your experiences and preparation of a simulation. Basically, it takes you from a first-person view of you as the anesthetic provider in a animated virtual simulation. It does provide real-world changes in the patient as the blood loss progresses, so you'll have to monitor your anesthetic level, your fluid volume levels, based on several things that you've done in the past. Urinary output, blood loss in canisters about the OR, blood loss in sponges that you may see throughout the OR, all the traditional things that you do to monitor blood loss and fluid volume status. Even prior to being a anesthesia student, you'll need to take all of those skills in order to successfully complete this animation. This gives you a good idea. You can see that it is a first person. You'll have the anesthesia machine to your right, IV poles to your left. You'll basically run your computer cursor over each area, the ventilator, the anesthetic gases, the volumes for oxygen and air, nitrous oxide, whatever you choose for your anesthetic. You may be asked at some point to evaluate pulmonary status and compliance within the chest. You can see that there's an anesthesia bag there to the right of the provider as he faces the two surgeons, and then you'll see the circulating nurse to the far right. These four personnel are traditional models for any OR, and so what we would like you to do is when you're going through that SimStat virtual simulation, each of the parameters will assess whether you did the appropriate thing in a manner for fluid volume status. So preliminary, we would like you to obtain a score of 70% or higher. And then what we'll do is we'll go through the case report, the practice guidelines for fluid volume resuscitation in class, and then we'll ask you to retake the assessment in the SimStat virtual simulation, and at the completion of that, we're asking that you get a score of 80% or higher. Please keep in mind that everything that you learn in there are real-world scenarios, and that ultimately, for your benefit and ultimately for your patient's safety, we're asking that you get 100%, but for course evaluation purposes, 80% or higher is adequate. So we want you to be critical about the technologies that you are reviewing. So keep in mind that YouTube videos are not vetted and they're not peer-reviewed. So the information that you get out of these videos may be a little bit suspect. So we would also like you to review 2 other articles. The first one is YouTube as an educational resource in medical education. And this will give you some idea on how to critically look at the information that you're receiving on a YouTube video and make sure that it does have some kind of peer review. I think you'll find that the 2 videos that are providing the anesthesia care planning and trauma resuscitation and damage control anesthesia are follow within most of the parameters that are presented in the first article. And then the second article basically reviews whether virtual simulation is beneficial to nurses and nursing education, and it's a randomized controlled trial that looks at all the parameters that make for a good simulation. I think you'll find that the SimStat simulation is a very good simulation, and then that it'll give you a real-world assessment of where you're at clinically if you ever have to treat a trauma patient requiring surgery and anesthesia. So the first reference that you see there gives you the link to developing a care plan. The other references are those that you'll need to read prior to class. And then if you look at the last link there, it'll give you the link to anesthesia for major trauma and damage control surgery. I look forward to teaching you this semester, and I hope that you enjoy this lecture. Take care.